So let me see if I can recreate what you just said. I'm going to try to say it the same way for the video. You correct me if I'm wrong. So you had the surgery. The surgery itself went pretty well. Went home, and on the third or fourth day, a little bit sad, a little bit tearful, a little bit feeling of loss, a little bit grumpy. You were a witch with a bee? No? And so your thought is maybe we can give a psychological explanation. We could say that in the past you were attached to being a certain weight and that had passed, and now you're dealing with these changes and that's got an emotional impact on you. That was something like what you said. Is that correct? And I, in my usual excellent bedside manner, with a lot of compassion, go, nope, that's not it. So I apologize for that. But what we think is that women who are overweight have grossly abnormal, high, dangerous, deadly levels of estrogen. In other words, being heavy is associated with an increased death from breast cancer, an increased rate of breast cancer, an increased rate and increased death rate from endometrial cancer, cancer of the womb, an increased rate and death rate from blood clots, all of which are estrogen related. And estrogen in women is sky high when they're heavy. And the heavier they are, the worse it is. Now the wonderful part of the MGB is within hours of the surgery, we begin to fix that dangerous, deadly, abnormal estrogen. You're welcome. Long-term studies from Canada in Montreal showed that over 7 years, the rate of breast cancer in women who had a gastric bypass decreased by 83%. You may never have to visit with a doctor where he says, I'm sorry, you have a cancer, we have to decide what to do about your cancer of your breast. We either cut off the breast or we have to radiate it or whatever. And then chemotherapy and whatever. Your chances of that have just gone down by 83%. And that it happens so suddenly and so quickly is very exciting, just like we heard diabetes can go away quickly. On the other hand, if I told you you quit smoking and your chance of lung cancer would go down, that would be great. But I just wouldn't want to be near you when you quit smoking, right? Right here. I'm happy that you quit smoking. I'm happy that you're not going to get lung cancer and decrease your risk of heart attack and decrease your risks of all these other terrible complications of smoking. But during that first week when you quit smoking 2 packs of Camels a day, the chances that I want to be near you or work with you are slim and none. And in fact, we can help you. We already know what to do. During that time period where you go from a big-time smoker to a non-smoker, we can use a patch. We can use a nicotine patch to help bridge that unpleasant, difficult time. Long term, we know it's good for you. We know it's great for you to quit smoking. And what I'm telling you is long term, that drop in your estrogen is great. Oh, we just got our garbage can back. But during the short term, it can be devastating. 1 in 4 of the women who have surgery with us have low estrogen and have symptoms of crying, anger, tearfulness, and things like that. I could tell you stories for the next 8 hours of post-op patients who had a kind of a grumpy experience with low estrogen, and I still wouldn't even scratch the surface on the low estrogen stories I have. And what you said is classic, absolutely diagnostic. Unquestionably, you got the low estrogen. Now, one way to look at that is it's unpleasant to go through. Another way to look at it is it's great because you're not going to get breast cancer, we hope. But you don't need to suffer. You don't need to suffer with this. It's very easy to fix. Get a nicotine patch for your smoking. In this case, get an estrogen patch for the estrogen.
How long would I use that for?
It's very, very easy to tell. We will call your husband at the end of every week. Okay? If you know that the patch wears off at the end of a week. If your husband comes to you and says, "Dear, I wondered, do you think it might be time to switch that patch?" Right? That's when you know that you need to continue it. If he's not at your door, sweetie, come on, put down the gun. Then it's time to stop it. Okay? So it's very easy to tell. Here's our numbers. 75% of our women never get this. In other words, there's some people, they're tough and they can quit smoking. I hate them. Okay? I quit smoking 30 years ago. I hate talking about it because I could start any time. If they came out tomorrow and said smoking was good for you, I'm there. So 75% of women who have this drop in estrogen do not have symptoms, but 25% do. 25% of our women do. On average, people wear the patch for 4 cycles for a month. Some people for just 1 week. Some people for up to a year. The patch is a very low dose, and sometimes people need to wear several. And it's easy to tell. If you feel great, fine. If you don't, put on another patch.
Okay, so we got the patch thing done. So, but I'm confused because I've got the thrush going on, and the Gatorade makes me feel better, but it also makes, I don't know, my mouth is just in tragedy.
Okay, this is really great. Okay, I have people every day of the week for the past 12 years, many of them have thrush. Okay, you have thrush and you use a great word. You said it's thrush and it's tragedy. Okay, estrogen affects your coping skills. I got thousands of people that had thrush and they go, "Oh, I got thrush." In your case, it's a tragedy because the estrogen's low. Now, let me stop there and I'm going to come back and talk about thrush. But when a small event gets a major reaction, think estrogen. Okay? We had a lady sitting right up here in the chair because she was willing to be on video. And so we're videotaping her, and she says, "Excuse me." And we're going, I said, "What's wrong?" She says, "My husband's a really bad driver." And I said, don't let him. And she's, I'm going, here's a patient of mine. I want to be compassionate and saying something so try and help out. I thought, I will be rational. I'll help her see that crying over your husband's driving. I said, he probably was a bad driver before surgery too. I know, but I told him, now he has a patient for a passenger. And everybody's laughing at him. So we voted, and she needed an estrogen patch. So she sat down. Next lady comes up, sits down, says she'd be willing to be on video. And she starts crying, says, "My husband's a bad driver too." If thrush is a tragedy, think estrogen. Now, we're going to fix the thrush and we'll answer your other questions. Thrush, let me tell you tragedy. You're in the ICU after the surgery because you're infected. You've had a leak, you're bleeding. The surgery failed and you had a stroke. I mean, there is tragedy in life. Thrush is no tragedy. Yeah. Now, it feels like I'm going to get there, but I want to first focus on the estrogen. Because nothing else, you're focusing, and I understand it, on these other issues. The big picture is Gatorade doesn't make any difference, and we'll get to that. It seems like a tragedy because of the estrogen. Nothing will get better because you'll have another tragedy that will fulfill the role of the thrush in your tragic experience because of the low estrogen. We could fix everything and we'll never be able to make a person right. Think of this. What is postpartum depression?
The drugstore closes.
No. Postpartum depression is you give birth. You have a healthy child, the magic, the miracle of life, the most unbelievable experience of human beings, and the woman is sad about that. It can't be. That does not compute. Now, it makes sense if there's low estrogen. It makes sense because it's not a natural reaction, it's a drug reaction. Look, if I take away cocaine from somebody, their withdrawal symptoms are understandable because they're missing the cocaine. If I take away heroin, it's understandable. If I take away cigarettes, it's understandable. This is the same thing with the drug, the powerful drug estrogen, like postpartum depression. Instead of giving thanks for the miracle of life and a new child, if a woman's depressed, she's not crazy or bad or anything like that. Her estrogen's low. Okay? Thrush as a tragedy is low estrogen. Thrush happens to all of our patients every day. I see him, I talk to him about it. It's not a tragedy.
Okay, I may have overstated.
No, you feel that. No, your feelings are right because you're in the middle. That's telling us it's helpful. It's great that you said that because that is the perfect diagnostic tool. It's like we've done a CAT scan on your brain. That sentence is absolutely diagnostic. It tells us now immediately what to do. And we do need to fix your thrush, but that's small potatoes. The big thing is we got to fix your estrogen.